May I call upon stage the next speaker, Dr. Archana M. And may I request Dr. Prashant Gupta to chair the session, please.
Dr. Archana M has done her MD in pathology from JJ Medical College, and her area of expertise is oncopathology, and she has done fellowship from Kidwai Cancer Institute. She is passionate about the teaching, and she has many articles. I request her to start the session.
A very good afternoon to one and all. So I am very happy to present this study which was conducted in our department. So the title was Predictive Ability of Reticulocyte Hemoglobin Content for the estimation for low serum iron. So we have the Mindray BC 6200 instrument in our laboratory. So reticulocyte hemoglobin estimation is the measurement of hemoglobin inside the reticulocytes. It correlates directly with the functional availability of iron in the marrow, and RHE may be used in lieu of serum iron if we can demonstrate a significant predictive ability in the diagnosis of iron deficiency anemia and for the follow-up after initiation of iron therapy in patients with iron deficiency anemia. So the aims and objectives of the studies were as follows. So the primary objective was to determine the ability of RHE in predicting low serum iron, and the secondary objectives were to obtain a correlation coefficient between the RHE and the serum iron and also with that of different RBC parameters. The study was a prospective analytical study conducted in a tertiary care hospital over a period of 3 months. Patients who were evaluated for anemia with serum iron were recruited and the reticulocyte hemoglobin was estimated. Patients who had already received iron supplements and pregnant women were excluded from the study. A sample size of 250 was statistically suggested. Numerical variables were summarized as median and interquartile range, and categorical variables were summarized as proportions. A comparison of the median was done using the sign test. Spearman correlation coefficient was used to estimate the strength of correlation between RHE and low serum iron, and we proposed a cutoff of less than 50 micrograms for iron deficiency anemia. And the cutoff value for RHE was obtained after plotting an ROC curve. So moving on to results, 250 cases were studied. The median age of our subjects was 41 with an interquartile range of 20 to 59 years. A female predominance was noted with 58.8% of the study population constituting females. Of these 250 cases, 180 cases had a serum iron of less than 50 micrograms, which fulfilled the criteria that we have set. So as we can see here, an ROC curve was plotted to obtain the cutoff value of RHE for the diagnosis of iron deficiency. A value of 22.7 was obtained, which had a specificity of 95% and a sensitivity of 72% for the diagnosis of iron deficiency. Patients with low serum iron, the RHE was 16.2 with an interquartile range of 15.2 to 17.3, whereas the median RHE for patients with normal serum iron was 26 with an interquartile range of 22.2 to 30.6, and this difference was statistically significant with a p-value of less than 0.01. Here again we can see a correlation scattergraph and histogram of RHE against serum iron, and clearly we can see that low serum iron values correlate with low RHE levels. On comparing RHE levels with other RBC parameters, we found that the highest correlation was seen with MCH, and it also had significant correlation with other RBC parameters, all of which except for the RBC count. The correlation coefficient of RHE with low serum iron was 68%. The same thing is tabulated here, and as we can see, the best correlation was obtained with that of MCH, and there was no correlation that we saw with that of RBC count. Moving on to discussion. We know that reticulocytes are younger stage of RBCs with a lifespan of 24 to 48 hours, and hence they are more sensitive to iron deficiency, and they help detect iron deficiency anemias earlier than that of iron studies. And RHE is now found to be increasingly recognized to be of utility in identifying iron deficiency at an early stage and as an early marker of response to treatment. Our study further helps strengthen understanding the role of RHE content in iron deficiency anemia. So to conclude, RHE has an excellent correlation with low serum iron. It also correlates well with other RBC indices except for the RBC count. RHE value of 22.7 picograms has good sensitivity and a high specificity in diagnosing low serum iron levels. These are my references. Acknowledgements, I would like to express my gratitude to the entire department of pathology, the staff, technicians and postgraduates of JSS Medical College. Special mention to Dr. Vani K, Dr. Sheila Devi, our HOD, and Dr. Manjunath sir, who's our Deputy Director. Special thanks to BLK Max and Mindray and all the organizers of CUBE HDMI 2023. Thank you. I would just like to add one point, and I think after listening to the talk that has happened since morning based on the reticulocytes and its parameters, after listening to Dr. Ramon and Dr. Manoj, I think we'll have to go back and also look at the inflammatory parameters and then have a better correlation, sir.
No, I think the study is perfect because the situation is the patient have iron deficiency.
Yes, sir.
But both have iron deficiency. Anemia of chronic disease have an iron deficiency.
Yes, sir.
And absolute iron deficiency have also iron deficiency.
Yes.
The situation is both have low serum iron, low transferrin saturation.
Yes.
But is there any deposit of iron? This is the question.
Yes.
And this is the question only for the treatment.
Yes.
For the diagnosis is perfect.
Yes.
For the treatment, depending of the inflammation and to know if the deposits of iron are full or not.
Yes.
Or empty. But the study is perfect. No any complaint for this study. Fantastic.
Yes. Thank you.
You can follow up this study for the response of red hemoglobin for with the treatment. Response, how it is responding.
We have not got the follow-up data because majority of the patients tend to come on an outpatient basis and take treatment and get back, sir. So we will try to do a follow-up also in the further studies, sir.
Yes.